Okay, so I come in the patient's room, do hand hygiene. Hi, my name is Abby. I'm a student nurse at Troy. Today I'm going to be doing a head-to-toe assessment on you. Can you state your name and your date of birth for me?
Christopher Flewellen, and my birthday is 05/06/1997.
Okay. Do you need to empty your bladder before we start?
No, I'm alright.
Okay. Do you have any allergies?
I'm allergic to shellfish.
Alright. Are you experiencing any pain?
No, I'm fine.
Okay. So, when I first walk in the room, I do a general survey. Patient appears clean. They're dressed appropriate for weather. They have no issues with their range of motion or their gait. Their behavior is appropriate. So, what I'm going to do next is assess your orientation. Can you tell me who you are again?
Christopher Flewellen.
Okay. Do you know where you are right now?
Prattville, Alabama.
Do you know who the president is?
Trump.
Okay. Do you know what today's date is?
No.
Do you know what month it is?
Yeah, it's December.
What year is it?
2020.
Okay, it's good enough.
In the future.
Okay. So first, I would look at their scalp and their hair. His scalp is dry and clean. His skin color is appropriate for race. There's no lesions. I palpate the temporal artery. And then on this side. Okay. Can you take your glasses off for me? So we're going to go through the cranial nerves. We're going to start with the second one, which is the optic nerve. I'm going to briefly shine this pin light in your eye. Just look off in the distance, okay? Don't look at the pin light. Okay. So his pupils, they're equal, they're round, they react to light and accommodation. I would say his pupil size is about 2 millimeters. Next, we're going to assess the oculomotor trochlear and the abducens nerves, which is the 3rd, 4th, and 6th cranial nerves. So you're just going to follow my pin light, okay? Okay, and into the middle. Okay. Next, the trigeminal nerve, which is the 5th one. Will you clench your teeth for me? Like grit your teeth, yeah. Okay. And then the facial nerve, it's the 7th one. Wrinkle your forehead, smile, and then puff out your cheeks. Okay, you can put your glasses on if you want to, by the way. Next, the glossal pharyngeal facial nerve, which is the 9th facial nerve. Will you swallow for me? Okay. Then the vagus nerve, 10th one. Say ah. Oh, let me look. Yeah. Okay, and his uvula is at midline. Then the hypoglossal nerve, which is the 12th one. You stick your tongue out for me and move it side to side. Okay. And a spinal accessory, which is the 11th one. Turn your head against my head. Okay, on the other side. All right, and shrug your shoulders. Okay, and the last one is the acoustic nerve, which is the 8th one. So we're gonna do the whisper test. I'm gonna try and whisper something and just repeat it, okay?
Okay.
3.
3.
6.
6.
Yeah, I'm not the best whisperer, so I'm gonna palpate your carotid arteries one at a time. Okay, and then we're gonna listen for a breathe, so this is gonna be cold. I'm sorry. And on the other side. Okay. I'm gonna check your skin trigger, your neck, just pinch around the clavicle. Okay. I'm gonna assess your thyroid glands. I'm gonna stand behind you and feel on both sides. Does it tickle? I'm sorry. Okay, swallow for me. Okay. And then listen for a breathe with your thyroid. Okay. And really quick, I'm gonna do your lymph nodes. So pre or auricular, or however you say it, auricle, however you say it, post auricular, submandible, submental, superclavicular, and then postclavicular. I don't really feel anything. Okay. Then I'm gonna do your breath sounds. So each time I put the stethoscope on you, just do a deep breath in and out for me, okay? I'm gonna start here. And then down here. Oh, on this side. And I think I skipped this one. And the last one. Okay. Will you, I hate making this. Can you like turn around for me? Like so I can do your back? Okay, perfect. We're gonna do 6 back here. Just take a deep breath in and out each time. Okay. You turn back around. So the bronchial sounds up here, they're high pitched, low amplitude. The broncho-vesicular sounds, which are here, they're moderate pitch, medium amplitude, and then his vesicular sounds, they're low pitch and soft amplitude. So I'm gonna do your heart sounds really quick. Listen with the diaphragm of the stethoscope first. So your aortic is the second intercostal space at the left or right sternal border. So, and then the pulmonic, which is second intercostal space. What did I say right last time? Left sternal border. S2 is loudest here. We'll go down to Erb's point, which is the third intercostal space, left sternal border. And then tricuspid, which is the fourth intercostal space and left sternal border. And then the mitral, which is where you would listen to the apical pulse for 1 full minute. This one's at the midline in the fifth intercostal space. And then I would flip this around and go back through all 5 and listen with the bell of my stethoscope. Okay. So on his upper extremities, I look at the skin color. There's no lesions. His skin color is appropriate for race. His skin is warm and dry. I'm going to check the capillary refill on your fingers. Okay, it's less than 3 seconds, which is what you want. There's no clubbing on his fingers. He doesn't have any edema or tremors. Grasp my fingers with both your hands and squeeze. Okay, muscle tone and strength is good. I'm going to see if I can find your brachial pulse. Okay. You say it's 2+, and then your radial pulse. It's also 2+ amplitude. Okay. I'll stop again because you have to lay down next. So I think we can see. So look at his abdomen. You'd inspect it first. Look, there's no lesions or anything. His skin's dry. Skin is appropriate for race. They're gonna listen to your bowel sounds. You start in the right lower quadrant. It's gonna be cold. And then you go to the right upper quadrant and then over to the left side. And before you could say that there's no bowel sounds, you'd have to listen in each quadrant for 5 to 10 minutes. So then we palpate. And you start with light palpation. And it doesn't feel like he has any abdominal distension. It doesn't seem like his bladder is distended either. Okay, you can sit up. So then verbalize this part. You would want to check the genitalia, look at skin distribution, or hair distribution, skin color. You want to make sure there's no discharge. The urethra for a male is midline. Verbalize the femoral pulse is below the inguinal ligament halfway between the pubis and the anterior superior iliac spine, and the lymph nodes, the inguinal lymph nodes are in the groin area as well. I'm gonna have to position this to do your... Okay, now we're down here to look at his lower extremities. So, you look at hair distribution. There's no lesions. His skin is warm and dry. His muscle tone, strength is fine. There's no edema, no tremors. Oh my gosh. Okay. I would do his capillary refill by pressing on his toes and seeing how long it takes for the blanching to go, the skin color when it turns white to come back. You want it to be less than 3 seconds. Then we look at his dorsalis pedis pulse, which is going to be like on the top of the foot. And he says 2+. And then the posterior tibial pulse, which is going to be on the inside of the ankle. Let me do it on this side so maybe you can actually see. Okay, that's it. Then before I would leave the patient's room, I would make sure that he, both sides rails were up, the bed was at the lowest position, call light was within reach, and I would do hand hygiene before leaving.